But I'm also commenting on the FDA's suggestion of using West. I think that it's
intrigued earlier by the commentary. I think it was from a gentleman who was in my line of sight about how dystrophin effects might transfer beyond specific fibrils to their neighbors. But I don't fully understand how this might work. So perhaps you might elaborate.
Who is the question for?
Well, there's a professor in the audience who had talked earlier about evidence that fibrils might generalize. The dystrophin levels. Well, if you can't do it, that's fine.
Yeah,
but I was intrigued by it.
Sure, thank you. I mean, for the record, I'd like to have the question be known, but I think in the interest of being sure that we give due consideration to the remaining questions, we should move on, unless Dr. Obiagale has a final comment on this.
No, I just wanted to say, it's one thing to talk about change, but the other thing is, I think B asked about the clinical correlation. So whether there's change or not is one issue, but if you remember, if you looked at the 4 individuals with the best 6-minute walking times, there was actually no correlation. 2 of them had the highest levels of dystrophin and 2 had the lowest levels of dystrophin. So to answer that question, the clinical meaning is not clear based on that.
Okay, thank you very much. So my job is to try to summarize what I've heard.